Chamgachitab Kalenjin obo itagat en tetutetab Health Watch. Kainenyu ko Karen Cheriot. Asigemuch kekirinda kaimutietab COVID-19, kokomwa serikali kole moche kovaccineten biik cheite 10 million kotomo kobek kenyini. Ak en betutab raini kemoche keng'alalen tetutioniton for COVID-19 vaccination. En studio, amiten ak Dr. Simeon Kibias, kobun Ministry of Health. Itagat missing.
Thank you, Karen Cheriot.
En planning ko komong serikali kole moche kovaccineten 10 million people ak 5.3.
Yes.
Moich akoba this plan, akoba this campaign.
Thank you, Kongoi, Karen. Serikali kukimit panda nekikochin biik sindanutab kirindaetab COVID-19 akakokon kole kimache kerut biik 5.3 million komait Mashujaa Day, tarik 20 mwezi wa 10. Ko that campaign konyoru kole sikosikyi keit kenyor biik cheyamat kosikyi sikeyat emet. Amu nyumnyum kechanjan biik cheyame sikosikyi kekirinda komie COVID-19. Yeah, the right population, the number, percentage, the target is over 60% of the adults eligible, and to get there, we must accelerate the efforts to reach a good number of people. So the government has given a target to vaccinate 5.3 by Mashujaa Day this month. And that what it takes is that those who are 50 years and above should get the vaccine. Also adults who have other conditions, maybe diabetes, any other chronic illness, heart condition, lung disease, HIV, anything else, should also be given a chance to be vaccinated. And even pregnant mothers, as long as they have been recommended by physicians, they should also be vaccinated. So this effort will target all and leaving no one behind. So all those who are eligible should be accessed the vaccine. And there is a call to ensure kwamba vijana ambao wako na uwezo wa kusaidia wakubwa wapeleke wenye wanafaa kupewa chanjo, wapelekwa kwenye kituo ambaye imesajiliwa kupeana hiyo chanjo ya COVID-19 bila kuchelewa. Yes.
Ak enguna ko gochingo picture tata vaccination noton.
Nguna kotomo koit ngele kiwango karibu 3.4% of the eligible adults chikokonyor. Yeah. Kotomo koit kiwango nekimache 31% chiki at least kerut, lakini che fully vaccinated 3.1%. Kotomo koit the right number. About 930,000 kuchikikonyor sindano chekiyomotin. Ko through 2.8 million kuchikikonyor kityo sindano. Kotomo koit kiwango. Nene kemache kesukuman koit 5.3. Actually kemwa 10 million by the end of the year. At the end of the day, the government would like to at least vaccinate all adults. That's about 26 million. So the target of over 60% coverage of the vaccination. So a bit now because again herd immunity. And when you guys vaccinated enough number, is prorate yes. So nyum kapsa konyor the right numbers. Yeah.
Kai mo chagoba the groups of people cho targeting in this Pata Chanjo?
Yes.
Kaa chonjo.
Yeah.
Ko amune asigo nyolu isich this vaccine?
Nyolu kenyor vaccine amu nguni ngengololi kokoit several variants cheter eng chekibatai like Delta variant ne iletoge eng haraka. Name chitugul ileto chito netinyei ako name chematinye. Ngonam chemengechen konyo konamda cheyosen ak chetinyei kaimutik alak. So Delta ko variant ne korom ne bichi amu iletoge eng haraka ako konu miondo nebo haraka. So biik chechang chekanam Delta admitted in a higher proportion. If you end up being admitted, the condition becomes more serious in Delta. Ako much ke leta bigalak infect others more faster than the original. So neni ki lazima ke go in vaccination ki. Chanjo ko ay borto ko kimit so kirinta COVID kumanamen ako sa kik sume lete inam te bigalak. So ngerut adults ko nyong miandap COVID-19 in population in big. So nyong ko baru kole magolet koroi pa COVID-19. So variants mie amu nangaya kirinda komye ku sene etap ke vaccinated la kemigejen engi ba ju measles ak pneumonia ki pongo pneumonia ma ki dogula ke cha kemigejen ko tombo tishik mut tigi mo nyor yagi tombo ke toy vaccination of pneumonia lakini siku hizi ko mingo meet so ne po muhimu kora ko chanjo kusuya ni meet ne bunu COVID-19 kiko bek pik 1430 kongete ko toge koroi ko magararan meet aenge ko magararan amu mamie manyumnyum ke magaran ke bek pik chokuno angoy ko magrut pik umeitos bik chang ako magararan yeah lazima kesuyan
ende ko kikale serikali ngot ko koisich COVID-19 ko magi-prioritize inin kamun ko build immunity the system. Imucha nguno ngole chito kikonaman COVID-19 tos ko mucho tokwa kora pa kosich the vaccination ana mago miten haja.
Karen kongeng tebut noge teb chechang pike chang chemwoe ngulo kolen yeka konamen ko nyumnyum ketege nyor lakini ma iman ma yere serikali ko unoto ngot ko kiya konamen ko nyolu tinyoru vaccine nebo COVID-19 yes lazima inyoru siko kimit borto komye amu to mi variants alak chebone ko lazima ko nai borto ko vaccine ko e borto ko kimit ko ngomit ko nai ko nyit korotwe chito ngonyo ngumach konamen kubrige yes sasa nyumnyum nginyoru vaccine regardless of whether you have been diagnosed to have COVID-19 yes you are recommended by the government to get the vaccine yes and the vaccines full dose if it is the vaccines for given twice within the required interval you must get it and if it is one injection like for Johnson & Johnson so it's one dose yes.
In general, it's 2 doses. What is the intervals?
Interval could be specific a guidelines at that time.
Okay.
Yes. Ki dago ki para kidogo lakini ki ajojo kidogo amu ki nyoru che vaccines chama expire mapema. Yes. So kiso be guidelines ka kukon.
Tam go miten listit nebo sipitali seche tam going around in social media. Ole muchi sich chanjo.
Yes. Mi listit ne mu kenyor eng website nebo Ministry of Health. Natai ko kutaune facilities karibu 600. Baadaye ketese kutoka karibu 3,000 mpaka mwisho hata 7,000. All the facilities that have been approved to provide the vaccine. Yes. P2 listing out of website number Ministry of Health. Yes.
Ota mso update ni
otese. Yes, ki update ni amu live the list ko mu ki update. Yes.
What is the reason as you update?
Lazima ka Kenya Medical Practitioner and Dentist Council check and list it against what is available in that facility. Lazima ikuwe na the minimum requirement, staff, equipment and all that is required for vaccination. Yes.
Ngengalalen process number vaccination. Ya no macho anyo awasibitali ba page vaccinate non ke konon chanjo.
Yes.
Those process no tongona.
Magoro the process because kige gany ko crisis much ke pre-register through the website of the ministry. Is be in the details ya Google. Sige kige kongite ko age koik rahisi. Anan iwe kora keregistan kora eng sipitali. Yes.
So iwendi kityo
Yes. WHO health.go.ke inyoru. Tai anan iwe ak kitambulisho nengung kesirin kora ak inyoru. Ako free. So mami shida age tugul. Ngotomo iregistan ine yundo. Go ngiyai pre-registration kora koik rahisi. So at the end of the exercise kora koboru kokoni tarehe nebo second visit kulingana na vile imekuwa programmed. Kwa yetar inyoru kora certificate based on you can print your certificate. Yeah, that is the advantage of that system. Yes.
Uko valid certificate not in all that tugul.
Yes, valid. Yama valid ko kegoni kora the right procedure where necessary. Yes. And it is online, so it can be verified.
Oh, okay.
Yes, especially for those who want to travel. Yes.
Amege wegen kitigen uliko kagimwa akobo the numbers chebo 5.3 ak 10 million.
Yes.
Tos imuchi ine kole which counties chekokosich the most number of vaccinations against which counties chetindo the list?
Me the list. Tagu kokocharbon counties. Kou Nairobi kubune 3 nya agerun bune 29.7%. Komi kora Kiambu. Kou notok komaya percentage kere kwendi komye yame kotokoyet ke the facilities kokimit amu toku tarakwimu tugul chebo the coverage. Nyolu kotokokim counties efforts chekakimwoe koityi biik tugul sikosikyi konyor the right percentage. Matinyi ile counties alak chemi barak chekwae chekonyor county age tugul akot chechok chebunu gaa komuch koit 100% against the target nekimoche. Amune si yeku namba 4, namba 5, namba 10. Elia makiboru kebwa komie akaiker kako dunia kikekoito 6.3 billion doses globally. Chikikerut biik 3.6 kokikonyor dose billion. Akerute biik karibu 45 million daily globally. So ikere ile kit nekararan. Matunge kuchebo let tun kakitoi kende orodha kole kwacheke chenamu nebo let eng vaccination. Yes.
Oboisie ak the county governments.
Yeah?
Oboisie ak the county governments asiomuch okoite chanjo ichuton.
Counties tugul kokoito chanjoinik. Yes. List nebo facilities chutok saidi ya 8 komi counties tugul.
Lakini nigeri ko miten biik the marginalized communities kou the pastoralists anango biik chemaimuche kosich the health facilities. What is the strategy choboisien oiti bichuton? Ak kora ko vaccinations chou polio ak the rest.
Yes.
Oboisien the door-to-door method.
Yes.
And simato transiten COVID-19 vaccination koek door-to-door.
Thank you, Karen, for that question. Efforts are being made to ensure that everyone is brought on board and is given a chance to get the vaccination, even in the arid and semi-arid land or hardship counties, in that mass campaigns have to be done everywhere in the country. That one, we favor that. We are taking a campaign beyond the facility. Outreaches, what we are calling them outreaches, have been encouraged twice a week at least. Facilities have to plan with the community around to make sure that they can go beyond the facility and visit the congregate settings where people are together. And this will be done as much as possible depending on the logistics of cold chain system. Sometimes the limitation is the cold chain because you have to maintain certain temperatures for these vaccines, and also when you break the vial, then you have to ensure that you have the right number within a short time. So as much as possible, efforts will be made to reach the persons. If guided by the community health strategy, members can also be reached where they stay. But initially, we would like to have outreach to concrete settings like where people are, schools, prisons, institutions, and where if the pastoralists are in one grazing area, that can also be done. So, but it has to be planned by the community together with the facility. Make sure that we minimize wastage also. Yes. Ideally, we should be able to reach everyone. And if, I'm sure, if there is a needy case, it has to be taken there. Yes.
Kongoi missing.
Yes.
Amege ngalale na about the vaccinations. Nguno ngo tindo Kenya about more than 5. Anongo about 5 variants. Miten vaccinations go as
vaccines.
Yes.
Yes, me.
Tindo tofauti inon.
Kongoi Karen eng tebutino keteb mut vaccine cheketinye nguno. Much keger kele boroindo nekaran nguno kele kitinye tugul. AstraZeneca, mi Johnson and Johnson, ako mi Pfizer, mi Moderna, ako mi Sinopharm. Tofauti komami. Vaccine nekararan ko nekakikon. Mewete bile amache nin age nin karanit kainet.
So makikonin
ane ko kiarut AstraZeneca waeng kianyor waeng. Akot sikik chechuk ko kikonyor AstraZeneca. Ak tupchosiek chuk alak ak choronok tugul chebo boror. Yes.
So muchi iwe sipitali akile mamachane AstraZeneca machane Johnson.
No, makararan. Ma recommended. Ma nyalunot kayai kunoto. The best vaccine is the one which has been given to you. So take it. Remember, kimi betu niki expecting a lot of AstraZeneca, but you see India, the demand went up. So they ended up using it for them. Now they have vaccinated close to 1 billion of their people. So the vaccine is good. Once you get it, get it. You don't wait for tomorrow and say, kaya nage. Gen got ko karongo ako bekchoda. Got ko might be kwa ko ito booster ako le magi kuno. Ako bekchungo batay. So vaccine karge to amu ay kasit agenge. Ineti borto ko boryagen korotweken COVID-19 alak tugul. So the best vaccine is the one you have been given by health facilities. Yes.
Kole serikali kole mache by 2022 vaccinate nearly all adults.
Yes.
By end of 2022. Lakini anigeri komiten some hesitation amongst some adults. Toso tinde strategies ainon oitipi chuton.
Kongoi Karen, kero huya mwat katai amune sinyoru vaccine. Sima goromit miondo yung porto, sima wa sipitali, ako sima nene te porto, sima tekin ko ipene sabi. Ko kararan ko nyor pik tugul. Mwisho yuko tungo boru. Ako choko iker ke mwa yung nyo kole cheki gerut ke vaccinated ke ko chanjo chanuka na chanjo ko ngering ke bendi hospitali ngering ke mutige ko jin oxygen ngering ke ibeti sobet so iboru ge esabu ke chege chutom go nyoru ko chuta ke chegonu ko miansa so akot kite ge nyor tukula mu iboru ge akot eng dunia mesam nagibon agone sabu ko boru ge kole emotunwek chega gerut bikwai kwendi ngweny miondo wendi ngweny meet ako yote in emengwai ako ta kotestai eng boisionik ko kila kobendi tai kotesetai emono tesetai emet ako testai county ako testai kotab chito nekakowek bikwai kokornit ake yot biik kobendat ko kila komakite yoto kototomo kerut amu much kowek ako walak nye delta nguno mu konya ake kamdanda kwake ko majumjum ko kwa chek chetege yonoti kekere biik ak keborien meet of COVID-19. So iboru hesabu kora kole kuya kakamwat katai kole ngeringen biik cheibotseni sobet eng chekakonyor vaccine. Yes. So we hope, we are very optimistic kole we shall get the target. Amu mi serikali akine kochobe mpango konget kole for local production, at least in the initial phase, to start packaging the vaccine. It will be easier and more accessible. So availability of the vaccine will be made easier. So you can, if we have attained 3.31% with the difficulties, and then fully immunized, we have now over 900,000. So with the vaccine availability, people's turnout will be very good, because the hesitation is now probably watu walikuwa na wasiwasi kule, pengine nipate dose moja na ile nyingine sijui itapata wapi, kule maybe wacha ikae. But now when the vaccines availability will be very good, so we expect the numbers to go up. And when the people see the benefit of having been vaccinated, like we've already seen when we vaccinate our under fives, you get less hospitalization because of measles, because of pneumonia and all that. So there are the benefits of vaccination is far much outweighs the not being vaccinated. Not being vaccinated is a liability. To me, it's a risk, not worth taking. You should not. Yes.
Yon isich your vaccination, you're fully vaccinated.
Yes.
Tosi muchi ibur ko kitambo, isocialize na pick ko kawaida, mati latch mask.
Kongoi Karen, by your question. Now look, to be very clear, that going back to normalcy has to be done scientifically and professionally, and in a systematic way. So do not go back to normalcy until the experts within the country have put together the figures, assess the situation, and then given their opinion. Because as for now, you have your vaccine, full dose, and still keep maintaining the public health preventive measures. That means wearing of face mask, the right face masks, and properly, hand washing, and social distancing. Those ones must remain minimum standard on top of the vaccination until a time when the proper announcements will be made. And the sooner all of us attain to the right percent coverage of the vaccination, the sooner we will go back to normalcy. So we can't just wait. Don't say until Karen does, then I vaccinate. Because it takes you and me and the rest of us to bring the numbers. We can't get to 26 million if everyone decides, I wait for my neighbor to go and do it first. It is all of us that brings the number to the required level. So let's all go for it, and then you will see the numbers will come. And if we get the numbers soon enough, I'm sure the reopening will be much faster and sooner than later.
Kongoi missing.
Yeah.
Ketorati tosi mache imwachine bigaf Kalenjin chetoma gosich vaccine.
Kongoi kapsa. Kongoi Karen Baroinda Kakas TV for this opportunity and for being a very important stakeholder in passing this message. We also thank the government and for the efforts made so far, and my fellow colleagues who have put together all plans. That's not been very easy. Most of us, the health workers, the frontline nurses have already gotten the vaccine, good proportion. Teachers and non-teaching staff and all those who are handling commuter people have gotten the vaccine, and I'm sure they are much safer. Amwajini pick up kutit and you know at the end of the day, ko chitukul class magurib sabet agirib ke tukul. So ko seki saru big chok chamanik chok big chok kyose matege bet big cheki chamme lahok sikik mami ore ataka nege kirintoye mami ore ataka nege kirintoye ngi ne nyum kosir sindanut chanjo notok naga kage koni free ako quality ako chamat kage ana che kigerute che ya mami serikali mami chi eng dunia ne tos kon gene kole kuistabi kwani tom kalia saka magane nenye ango chang problems ara ngimete sindanut agituye koroito agiwe agitite biik alak so kwa ngo boisiet no giyai asoko toret ngongo na kibegu ako biik chebegu wairo le biik tugul ako che yoe boisiet komie mami chi ne ba maana eng emet so matisaske inyarge ile mabogi ngotep anani ilaske ibirteget ile kokonama onyala agenge konyala enguyo sala komwoe so maitoge ndait betu no ke kon oxygen ko inyege ile ne ako matin sayo makotoreti sindano kiborinen ke konin oxygen sangabe komnyana sindano ko chengenyor sindano ko kokeker ngoit sipitali komoja kowekse anan komowendi sipitali tepchinigei eng gaa iomishe komie itebi isobe. So biik chok chang makararan ikere meet eng tai ako meyai kiy. Saru bororiet nyo bo kutit komugul ameku ne tun kabek koistogei koroi kekure COVID-19 amu tun kwendi tun kobeku ngotun maikunyegei neking'etu nemanyoru sindanut tun ile ne ako kakeker kasi kakeker tugul otun nome biik naking'ololi biik keng'ololi kele kikitoretin. How did you help the community? Kitoret biik masomen chi siling amalechin chi yai kiy alechin kityo sindanut simelete kiy. Ma costing anything. It's not costing you anything. Just walk in to the facility. Within 10 minutes, you have your vaccine and you remain safe. So you are not infected, you are not transmitting. Haupeani ugonjwa. So kaitoret umefanya kazi yako, tunakupiga makofi. Iwetestai kazi ng'ung, itech emet. Ko ang'inyi anyon ne koiyeshe. Konamin koroito, ilalate eng yo iletate. Kobek sianjo ak sianjo akakinye. Situngelen amu kibek biik ko kibichu kimakirut matiyo kunoto. Situnge amenen kele sikoletakei koroi koisto biik chok chamanik chok chemi yo kokakibichu makirut makararan makero kararan. Akakokongei biik tugul amati masasin chi eng emet duniani mami chi nekasasin kole sikerutin sikobarin. Kaba kochop chito kerichot eng olin kole sinyekorutin sirok iwe ngo tayari ketinye shida chechang. Mabwoti ale makararan ko keeshe sindanut. Ngerutech kuchi age tugul kobeki kemwa. Keboiboitu tugul.
Kongoi mising. Chitab Kalenjin. Tos kokerutin sindanetab COVID-19? Angot kotomo kowekas kamune asikonyolu pakerutin. Ongetien wikini nyone asitakemuch keng'alal akobo mieindoab bortonyon. Kainenyu ko Karen Cheriot.